So I'm going to show you the proper way on how to spike an IV bag. The first thing you want to do is you want to make sure you grab the right drip set. So I'm looking right here at a macro drip set, which is a 10 drops per ml solution set, which says it right there on the bag. I also have here a 60 drops per ml solution set. So I will be demonstrating both of these for you. The first thing you want to do is get the right bag as well. So we're going to look at the correct solution set. I have an isotonic solution set of normal saline, 0.9% sodium chloride, 500 ml bag. I want to check color, clarity, sedimentation, vessel integrity, expiration date. For testing purposes, this is fine. Down here on the bag, we have our medication access port. We also have our IV drip port right here. We're going to open up the right drip set. And for this demonstration, I'm going to be using the macro for this 500 ml bag. The first thing you want to do is take this little white tab off, and then you're going to see that there's sterile caps on these drip chambers. You have one at the tip, and then one down at the bottom, which came off in the bag. And these tips, or these caps, are designed to cover the tips of the IV tubing, simply because we want to maintain a sterile field as much as possible. So the first thing we want to do is the flow control roller right here, we want to move to the top and then shut it down. We want to take this little blue cap off right here, take this sterile cap off right here. We're going to connect it in, quarter twist. And the reason why we shut that clamp down is because you see no water is going to be coming out. If this was open, water would start flowing out through the line and water would be going everywhere. So now all we want to do is squeeze the drip chamber about 1.5 times. We want to go about halfway. If there's any air bubbles on the side, you can kind of gently tap it. And then as I open this up, I'm only going to open up the flow control valve about halfway, and you can see that the flow is going. And you can see that it's going to stop about right there. So that's where it stopped. And the reason why I stopped there is because it's at the same level of the bag. So I'm just going to move it down a little more. And that's a proper way to spike a macro drip set. Now for a mini drip set, I'm going to show you a different technique where we check the same thing. We have our bag here. This is a 250 ml bag of normal saline. I'm going to check color, clarity, sedimentation, vessel integrity, expiration date of the bag. I'm also going to open up the correct drip set, which is a micro drip set. It says 60 drops per ml. That means 60 drops equal 1 ml of fluid. I have my sterile cap here. I also have my sterile cap on the end of the IV tubing. Take the yellow tab off. Then you see that I'm going to open this up. Move the flow roller control valve to the top. If I hang my 250 bag right here. Again, I'm going to take my sterile cap off the tip. I'm going to spike it. Now with a 60 drop per ml solution set, that means it takes 60 drops to equal 1 ml of fluid. So you can see it's going to be a much slower rate. So we want to get this drip chamber about 2/3 of the way up. So about right there. And you can see I have some bubbles right here. So what I would do is just gently tap it to get rid of any excess bubbles that may be in that drip chamber. Because as I flow this, similar to what I just showed you earlier, we don't want the air bubbles to create and get into that line. So this is going to be a much slower drip than the macro drip set. And as this is going, we tend to use macro drip sets for fluid resuscitation or just IV medication administrations. We use micro drip sets, which is what I'm showing you right now, for IV medication drips, medication administration. Put it to the top, and then I'm ready to go.